An extraordinary 2-week quarantine of a virus-riddled cruise ship has ended today in Japan. Hundreds of passengers on board the Diamond Princess began disembarking. The ship appears to have served as an incubator for the virus instead of an isolation facility meant to prevent the worsening of an outbreak. More than 540 people have been infected among the nearly 4,000 passengers and crew. Only those free of infection are being repatriated. In a further development, Russia says it will temporarily ban Chinese nationals from entering the country. The move goes into effect Thursday at midnight Moscow time. So far, Russia has very few confirmed cases of the COVID-19 disease caused by the virus, but Russian authorities have hospitalized hundreds of people as a precaution after they returned from China. While data from a study of the virus undertaken by Chinese researchers shows that most cases have been mild, it's the sick and elderly who are most at risk. Health workers on the front lines are also vulnerable. New infections have been falling across China outside the city of Wuhan, the epicenter of the outbreak. But the World Health Organization remains cautious.
Sometimes this is projected as a mild disease, and sure, most people just get a very mild disease and everything is over in a couple of days. And that's true. And for those who have that, and for the younger people and adults who get that form of disease, that's great. But there's a significant number of people. Remember, 20% of people who get this disease are either severe or critically ill.
Beijing authorities continue to enforce a strict 14-day quarantine rule on all those who have returned to the capital after the holidays. Beijing's Forbidden City has become just that. Hermione G, Euronews.
Well, for more on the latest developments, let's speak to Professor Mark Fielder, Professor of Medical Microbiology at Kingston University in London. Thank you for joining us this morning.
Good morning.
Now, as I mentioned there are questions to the Japanese authorities about how they controlled the virus on board the ship. It seems that despite putting in controls, the virus was still able to spread on board. How did that happen?
Well, I think it's a difficult situation because logically you'd think that if a group of potential patients were on a secluded vessel like a ship, then that'd be the safest place to put them to make sure the disease didn't spread. But I think perhaps what wasn't thought about was the intermingling of patients or people on that ship and therefore the spread of disease between them. And this is a bit of a difficult one because, as I say, logically it might be the best thing to do, but with hindsight it appears that this perhaps wasn't the best thing to do. Perhaps getting them off and quarantining them elsewhere might have been better. So it's a difficult situation, unfortunately.
So what do we know about how the virus is actually transmitted? Because up until this point, people would be thinking it had to be by touch or, the virus might live outside of an infected person, but not for very long. If people were separated on board this boat, how was it that the virus managed to spread to hundreds of other passengers?
Well, what we've got is a situation that I think the WHO is still adhering to, and that is that the virus is spread between patients who are in close contact, and that is to say less than 2 meters for more than 15 minutes. It's spread by droplet infection, so coughing and sneezing, and perhaps if you've been coughing and sneezing into a hand and then touching a surface or another person, then spread that way. So you can see on a vessel such as a cruise ship that the intermingling of people might have allowed that to happen, which I say is regrettable, but with hindsight it's something perhaps people wouldn't have done. But we're learning about this virus all the time. I think we need to remember a couple of months ago we didn't know it existed, and now we're in the epidemic in China has unfolded as we've seen.
So the people who are being able to get off of the boat, off the Diamond Princess, are going to have to be put into further quarantine. Will that be sufficient measures to stop anyone who has the virus but doesn't yet know it, who's come off, stopping them from passing it on to someone else?
I would imagine so. I mean, we've seen cases in the UK and other parts of the world where this type of facility-based quarantine has worked very well. In fact, we've just released from the UK a group of people held in the north of the country who've been tested after they come back from repatriation from China. They were tested by the accepted methods prior to being released. They've now not got the virus. They've been released back into society. And I think the same thing will happen when these people go back to their countries of nationality. The same thing will happen once they've tested negative for the virus. I think the protocols at the moment is on 0, 6 and 14 days. Assuming they are negative, they will be released and able to go home.